A spinal cord injury, also known as an STI, occurs when trauma or disease causes damage to the spinal cord. It is estimated that over 85,000 people in Canada and 500,000 people worldwide are living with an STI. An STI can result in secondary complications and chronic conditions like pain, spasticity, bowel and bladder problems, heart disease, and depression and anxiety. Management of these complications and chronic conditions often requires using multiple medications. However, the use of multiple medications can result in an increase in medication errors, overdoses or allergic reactions, visits to the hospital, and healthcare costs. Given the likelihood for high medication use among persons with STI, our team wanted to look at medication use in older adults with traumatic STI and explore experiences with medication and medication management among persons with STI. To address our first aim, we looked at health data of persons with STI who were 66 and older living in Ontario. From reviewing prescription drug claims 1 year following the injury, we found that of the 418 people in our sample, 87% were prescribed medication from at least 5 different drug classes, 79% of patients were prescribed opioids, and the average number of drugs prescribed post-injury was 11. We also found that persons who had consistent physician care were less likely to have a high number of drug claims. To address our second aim, we interviewed persons with STI over the age of 18 living in Ontario to explore their experiences with medication management. 19 adults participated in our study. Let's take a closer look at the experiences of a few individuals. This is Paul. Paul used to avoid taking any kind of medication before his injury. He was very healthy and enjoyed outdoor activities. After his injury, Paul described suffering from many secondary complications like urinary tract infection, hypotension, and pain, which made it necessary for him to take 5 medications daily to manage his symptoms. This story highlights the tension that many of our participants experienced when faced with the reality that they needed medications to manage their injury. Some participants expressed concerns about the safety of the long-term use of their medications, and many were fearful of negative side effects. Participants described preferring to take as few medications as possible, with some describing a fear about adding new medications to their regimen. Participants also described taking an active role in their medication use. They described adjusting their medication dose on their own through trial and error and talking to their providers to problem-solve medication issues. This is Sarah. Sarah realized that her medications were not as effective anymore, so she initiated a conversation with her healthcare providers to find alternatives. Persons with STI also described a desire to seek alternatives to prescription medications, including natural health products, physical activity, and specialized diets to manage their symptoms. The World Health Organization suggests 3 key tips for ensuring medication safety. First, know your medication. Second, check that you are using the right medication the right way. Third, ask your healthcare provider if you are not sure. So what does this mean for clinical practice? There is a need for more open and deeper conversations about medication management between patients and healthcare providers to improve patients' experiences with medication management after an STI. It is also important for resources to be provided to healthcare providers and persons with STI to inform them about common challenges with medication use post-injury. For more information, please see the following papers.